For today, I'll be discussing about the lymphatic system. So basically, the lymphatic system is a network of tissues and organs that help rid the body of toxins, waste, and other unwanted materials. Basically, the functions of the lymphatic system includes fluid balance, fat absorption, and for defense. The components of the lymphatic system includes the lymph. This is the fluid that enters the lymphatic capillaries composed of water and some solutes. Other components include the lymphocytes, lymphatic vessels, lymph nodes, tonsils, spleen, and the thymus gland. The lymphatic capillaries and vessels are the ones that carry fluid in one direction from tissues to circulatory system. The fluid moves from blood capillaries into the tissue spaces. Your lymphatic capillaries are tiny, closed-ended vessels, and the fluid moves easily into it. It is found in most tissues and they join to form the lymphatic vessels. On the other hand, the lymphatic vessels resemble small veins where lymphatic capillaries join, and they are also one-way valves. The right lymphatic duct, where lymphatic vessels from right upper limb and right head, neck, and chest empty. It also empties into the right subclavian vein. The thoracic duct, rest of the body, empties from the lymphatic vessels. It empties into the left subclavian vein. This image shows the lymphatic system and the lymph drainage. The image A shows the major lymphatic organs, which includes the tonsils, the lymph nodes, the spleen, and the thymus. Lymph nodes are located along the lymphatic vessels throughout the body, but aggregations of them are found in the cervical, axillary, and inguinal areas. The image on the right shows the lymph from the uncolored areas flows into the thoracic duct before entering the blood. Lymph from the darkened area flows into the right lymphatic duct before entering the blood. The image shows the lymph formation and movement. Image A shows the fluid movements from the blood capillaries into tissues and from tissues into lymphatic capillaries to form the lymph. Image B shows the overlap of epithelial cells of the lymphatic capillary, which allows fluid to enter easily but prevents it from moving back into the tissue. The valves located farther along in lymphatic vessels also ensure one-way flow of the lymph. Lymphatic organs include the tonsils, the lymph nodes, the spleen, and the thymus. These lymphatic organs do have lymphatic tissues, which is characterized by housing many lymphocytes and other defenses such as the macrophages. These lymphatic tissues have very fine reticular fibers that holds the lymphocytes and other cells in place. The tonsils form a protective ring of lymphatic tissue around the openings between the nasal and oral cavities and the pharynx. They protect against pathogens and other potentially harmful material entering from the nose and the mouth. There are three groups of tonsils. The first one is the palatine tonsils, which are located on each side of the posterior opening of the oral cavity, and these are the ones usually referred as the tonsils. The second one is the pharyngeal tonsil, which is located near the internal opening of the nasal cavity. When the pharyngeal tonsil is enlarged, it is commonly called as an adenoid. When enlarged, pharyngeal tonsil can interfere with normal breathing. Sometimes the palatine or pharyngeal tonsils become chronically infected and must be removed. The removal of the pharyngeal tonsil is called a tonsillectomy, and the removal of the palatine tonsil is called an adenectomy. Lastly, we have the lingual tonsil. This is found on the posterior surface of the tongue, and it is less infected than the other tonsils. Next of the lymphatic organs are the lymph nodes. The lymph nodes are rounded structures varying from the size of a small seed to that of a shelled almond. Lymph nodes are distributed along the various lymphatic vessels, and most lymph passes through at least one lymph node before entering the blood. Lymph nodes are found throughout the body and they are classified as superficial or deep. There are three superficial aggregations of lymph nodes on each side of the body. First, you have the inguinal nodes of the groin. Second, the axillary nodes of the axilla or armpit. And third is the cervical nodes of the neck. Most of the lymph moves through the immune system and is activated if foreign substances are detected. And the removal of microbes are by means of the macrophages. This is a cross-section of a lymph node. In this image, you will see that it has a capsule, which is made up of dense connective tissue that surrounds each lymph node. Extensions of it are called trabecula. It is subdividing a lymph node into compartments containing lymphatic tissue and lymphatic sinuses. The lymphatic tissues are consisting of lymphocytes and other cells that can form dense aggregations of the tissue called your lymphatic nodules. Note that the lymphatic nodules are not the same as lymph nodes, and they are areas of tissue within lymph nodes and other organs. Lymphatic sinuses, on the other hand, are spaces between the lymphatic tissue that contain macrophages on a network of fibers. Lastly, we have the germinal centers, which are the sites of lymphocyte production. Here, you will also see the different afferent lymphatic vessels and the efferent lymphatic vessels, as well as the innervations of the arteries and the veins. The arrows indicate the direction of the lymph flow, and as lymph moves through the sinuses, phagocytic cells remove foreign substances, and the germinal centers are the sites of the lymphatic production. The next lymphatic organ is the spleen. It is roughly the size of a clenched fist and is located in the left superior corner of the abdominal cavity. It filters blood, detects and responds to foreign substances, destroys old red blood cells, and serves as blood reservoir. Trabeculae from the capsule divided the spleen into small interconnected compartments containing two specialized types of lymphatic tissue. First is the white pulp, which is a lymphatic tissue surrounding the arteries, and the red pulp that contains macrophages and red blood cells that connect to the veins. This image shows you the inferior view of the spleen. Figure A shows the innervation of the splenic artery and the splenic vein, while image B shows the arrangement of arteries, veins, white pulp, and red pulp. White pulp is more likely associated with the arteries, and the red pulp is associated with the veins. Although the spleen is protected by the ribs, the spleen is often ruptured in traumatic abdominal injuries. A ruptured spleen can cause severe bleeding, shock, and death. Surgical interventions may stop the bleeding, and cracks in the spleen are repaired using sutures and blood clotting agents. Mesh wrapped around the spleen can hold it together, and a splenectomy or the removal of the spleen may be necessary if these techniques do not stop the bleeding. Other lymphatic organs and the liver then compensate for the loss of the spleen's function. Next of the lymphatic organs is the thymus gland. The thymus is a bilobed gland roughly triangular in shape and is located in the superior mediastinum, which is the partition dividing the thoracic cavity into left and right parts. Each lobe of the thymus is surrounded by a thin connective tissue, what you call your capsule. The trabeculae from the capsule divided each lobe into lobules, and near the capsule and trabeculae, lymphocytes are numerous and form dark staining areas called the cortex. A lighter staining central portion of the lobules called the medulla has fewer lymphocytes. Apparently, it stops growing at the age of 1, and at the age of 60 it decreases in size. The thymus is a site for the maturation of a class of lymphocytes called the T cells. Large number of T cells are produced in the thymus, but most degenerate. The T cells that survive the maturation process are capable of reacting to pathogens. The mature T cells migrate to the medulla, enter the blood, and travel other lymphatic tissues, where they help protect against pathogens. Production of T cells declines later in life due to decreased functions of the thymus. The lymphatic system functions to help regulate fluid levels in tissue and provide protection against pathogens. This overview of the lymphatic system summarizes the processes performed by the lymphatic system. Lymphatic capillaries and vessels remove fluid from tissues and absorbs lipids from the small intestine. And then lymph nodes filter lymph and the spleen filters the blood. This also illustrates two types of lymphocytes called the B cells and the T cells. B cells originate and mature in red bone marrow, while the pre-T cells produce in red bone marrow and migrate to the thymus, where they mature to become T cells. B cells from the red marrow and T cells from the thymus circulate to and populate other lymphatic tissues. B cells and T cells are responsible for much of immunity. In response to infections, B cells and T cells increase in number and that circulate to the lymphatic and other tissues. How B cells and T cells protect the body is discussed later in this chapter. Immunity. This is the ability to resist damage from foreign substances, for example, microbes, toxins, and cancer cells. There are two types of immunity. First one is what you call the innate, which is present at birth. It's defense against any pathogen. It is accomplished by physical barriers. It includes chemical mediators, cells, and inflammatory responses. The other one is the adaptive immunity. It is also referred to as acquired immunity or specific immunity, and response is specific to the pathogen presented. Physical barriers. These are the first line of defense. They prevent pathogens and chemicals from entering the body in two ways. First, the skin and mucous membranes form barriers that prevent their entry. Second, tears, saliva, and urine wash away the pathogens. In this image, you see here different examples of the physical barriers to prevent infections. Chemical mediators. Chemical mediators are the chemicals that can kill microbes and prevent their entry into the cells. Examples would include lysozymes, which are found in tears and saliva to kill bacteria. You also have your mucous membranes that prevent entry of microbes. You also have the histamine, which promote inflammation by causing vasodilation. And you also have the interferons, which are proteins that protect against viral infections by stimulating surrounding cells to produce antiviral proteins. Also included in the lymphatic system are the cells. So white blood cells produced in the red bone marrow and lymphatic tissue that fight foreign substances. You also have what you call the phagocytic cells, which ingest and destroy foreign substances. Example, your neutrophils and your macrophages. Next, you also have your basophils, which are made in the bone marrow. They leave blood and enter infected tissues, and they can release histamine. Next, you also have your neutrophils, which are the ones who respond first to infection, but they actually die quickly. You also have your macrophages, which includes the monocytes. They leave blood and enter tissues. They can ingest more than neutrophils. They protect lymph and lymph nodes and blood in spleen and liver, and given specific names for certain areas of the body like your Kupffer cells in your liver. Next, you also have what you call your mast cells, which are made in your red bone marrow. They are found in skin, lungs, gastrointestinal tract, urogenital tract, and they can also release what you call your leukotrienes. Other cells also include your eosinophils, which are produced in the red bone marrow and release chemicals to reduce inflammation. We also have what you call the NKCs, or the natural killer cells. These are types of lymphocytes which are produced in your red bone marrow. It recognizes classes of cells such as tumor cells or virus-infected cells, and they release chemicals to lysis cells or to break down your cells. So these are the different types of cells that are found in your body, as we have already tackled in the lecture of blood. So you have what you call your granulocytes and agranulocytes, which are more likely on the division of your white blood cells. And this is a more complex explanation of what mast cell is. So mast cells are part of the immune system, and they play a role in inflammation. They help defend against pathogens and are involved in wound healing and tissue repair. They are found in most tissues throughout the body, especially those that interact with the outside environment, including the lungs, gastrointestinal tract, and the skin. So the mast cells are well known for releasing histamine during allergic reactions such as pollen or insect sting allergies. They play an important role in anaphylaxis. They can detect and respond to foreign substances, and when a mast cell is activated by a trigger, these granules release many mediators or chemicals that mediate reactions leading to symptoms. And this mediator is actually histamine. So mast cell disease happens when these cells aren't behaving normally. So this images that you see on on the right of the screen are actually how they look like under the microscope. So for the inflammatory response, it involves chemical and cells due to injury. They are signaled by presence of foreign substances, and they are stimulated due to the release of the chemical mediators. To further understand inflammatory response, let's use this diagram to understand how bacterial infection can be defeated through inflammatory responses. So once bacteria enters the tissue causing damage, it stimulates the release or activation of what you call your chemical mediators. So once chemical mediators are released, of course, there would be vasodilation, which increases the blood flow and brings phagocytes and other white blood cells to the area. There would also be a chemotaxis, and of course the increased vascular permeability, which allows the fibrinogen and complement to enter the tissue from the blood. After this one, of course, there would be an increase in numbers of the white blood cells and chemical mediators at the site of the tissue damage. And of course, the bacteria can be contained, destroyed, and phagocytized. So once bacteria has been killed or gone, of course, it would have a positive response of having a tissue repair. But if bacteria remains, there would be a need of additional chemical mediators being activated. So once chemical mediators are being activated again, of course, there would be a response of again adding up the number of the chemical mediators that can be released to continue the inflammatory response. So inflammation can be local or systematic. So with local inflammation, it is an inflammatory response confined to a specific area of the body, and symptoms of local inflammation include redness, heat and swelling due to the increased blood flow and increased vascular permeability, as well as pain caused by the swelling and by chemical mediators acting on the pain receptors. The tissue destruction, swelling, and pain lead to loss of the function. On the other hand, the systemic inflammation is an inflammatory response that is generally distributed throughout the body. In addition to the local symptoms at the sites of inflammation, three additional features can be present. So first would be the red bone marrow produces and releases large numbers of neutrophils, which promotes phagocytosis. You would also have pyrogens, which are chemicals released by microorganisms, neutrophils, and other cells, which stimulate fiber production. And the next is, in severe cases of systemic inflammation, vascular permeability can increase so much that large amounts of fluid are lost from the blood into the tissues. With this, the decreased blood volume can cause shock and death. So next is the adaptive immunity. The adaptive immunity is a defense that involves specific recognition to a specific antigen. So this is acquired after birth, and it reacts when innate defenses don't work and they are slower than the innate immunity. It has a memory and uses lymphocytes B and T cells and two types of antibody-mediated and cell-mediated responses. So terms related to adaptive immunity includes first what you call your antigens, which are the substances that stimulates immune responses, like for example, bacteria, virus, pollen, food, and drugs. For self-antigen, this is a molecule produced by a person's body that stimulates immune responses. You also have what you call your antibodies, which are the proteins that produce in response to antigen. So to understand how lymphocytes are responsible for antibody-mediated and cell-mediated immunity, it is important that you know how lymphocytes originate and become specialized immune cells. So first we have what you call your stem cells, which are made in your red bone marrow and are capable of giving rise to all different types of blood cells. So some of the blood cells that it can give rise to are the pre-T cells and the pre-B cells. Okay, so lymphocytes are the type of white blood cells which are involved in adaptive immunity, and they develop from stem cells, and they differentiate into specific lymphocytes such as B or T cells. So the differences of the lymphocyte cells are the B cells are type of lymphocytes that involve in antibody-mediated immunity, and it's originating from the stem cells from a mature red bone marrow, and they move to lymphatic tissue after maturation, which leads to the production of your antibodies. So the T cells, on the other hand, it is involved in cell-mediated immunity primarily and antibody-mediated immunity, and it matures in the thymus gland and move to lymphatic tissue after maturation, and there are actually four types. So in the image that you see here on your screen, it shows you what primarily the functions are. So for the B cells, they attack invaders outside of a cell, while T cells attack infected cells. So this is the origin and processing of B and T cells. So both B cells and T cells originate from the stem cells in the red bone marrow. B cells are processed from the pre-B cells in the red marrow, whereas T cells are processed from the pre-T cells in the thymus. And both B and T cells circulate to the other lymphatic tissues, such as your lymph nodes. So please remember where these cells to actually mature. Okay, so for pre-T cells, they are generated from the red bone marrow, but then again, its maturation happens in the thymus. Compared to your pre-B cells or the B cells, both generation and maturation happens in the red bone marrow. So next, let's tackle about antigen recognition. So lymphocytes have cell membrane proteins called your antigen receptors on their surfaces. The antigen receptors on the B cells are called B cell receptors, and those on the T cells are called your T cell receptors. Each receptor binds with only a specific antigen, and each clone consists of lymphocytes that have identical antigen receptors on their surfaces. So when antigen receptors combine with antigen, the lymphocyte is activated and adaptive immunity begins. So major histocompatibility complex molecule, or the MCH, on the other hand, contains binding sites for antigens. They are specific for certain antigens, and they hold and present a processed antigen on the surface of the cell membrane. They also bind to antigen receptor on B or T cells and stimulate responses. Next, we have what you call your cytokines. So these are proteins secreted by a cell that regulates neighboring cells. So for example, interleukin-1, which is released by the macrophages, and it stimulates the helper T cells. So in this one, it would actually show you how the proliferation of the helper T cells happen. So an antigen-presenting cell or a macrophage stimulates the helper T cells to actually divide. So just please study on how this process goes for you to better understand how your T cells or helper T cells are actually dividing or multiplying their numbers. So next we have your lymphocyte proliferation. So this one, after antigen is processed and present to helper T cells produce interleukin-2 and interleukin-2 receptors. So the interleukin-2 binds to receptors and stimulates more helper T cell production, and helper T cells are needed to produce B cells. And B cells produce antibodies. So this image would actually show you the how proliferation of B cells occur. So a helper T cell simulates a B cell to divide and differentiate into plasma cells, which produce now your antibodies. So there's a major difference on how the proliferation of your T cells and your B cells would actually look like. So next is the dual nature of the immune system. So basically, lymphocytes give rise to two types of immune responses. It can be antibody-mediated and cell-mediated. So antigens can trigger both types of responses, and both types are able to recognize self versus non-self, and they use specificity and have memory. So antibody-mediated, it is effective against antigens in body fluids such as your blood and the lymph. It is effective against bacteria, viruses, and toxins, and uses B cells to produce antibodies. So this is actually how an antibody structure looks like. So it's Y in shape, and it actually has two arms. Each arm has a variable region that functions as an antigen binding site. So this is the variable region. So at the ends of the variable regions, you will see there what you call your antigen binding sites. So the constant region can activate the complement or bind to other immune system cells such as macrophages, basophils, or mast cells. So in this image, the constant region that we are pertaining about is this one. So the lower region. Okay. So this is the constant region or the constant binding site. So this red here, okay, so it shows you the site where the macrophages, basophils, and the mast cells can bind to. So antigen binding site, this is the site on the body where antigens can bind. So when you say valence, this is the number of antigen binding sites on the antibody. And again, please remember the 5 immunoglobulins used to destroy antigens. So we have IgG, IgM, IgA, IgE, and IgD. So these are the classes of the different antibodies and their function. So for the structures of the IgG, IgM, and IgA, they actually look like this. So in your if you have your books with you, please be familiar, okay, on how the different structures look like. So heavy chains are the ones that are darker green, and then the lighter ones are the light chains. Okay, so you also have here the descriptions of the different antibodies and their functions. Okay, so please make sure that you will know their different functions. So next, the effects of the antibodies. Of course, they inactivate antigens. They bind antigens together. They activate complement cascades. They also initiate release of inflammatory chemicals and facilitate phagocytosis. So in this image, you will see the effects of the antibodies, where antibodies directly affect antigens by inactivating the antigens or by binding the antigens together. So antibodies indirectly affect antigens by activating other mechanisms through the constant region of the antibody. Indirect mechanisms include activation of complement, increased inflammation resulting from the release of inflammatory chemicals from mast cells or basophils, and increased phagocytosis resulting to or from antibody attachment to the macrophages. So in this one, letter A shows you the inactivation of the antigen. So an antibody binds to an antigen and inactivates it. In letter B, it is the binding of antigens together. So antibodies bind several antigens together. In C, this is the activation of the complement cascade. An antigen binds to an antibody. As a result, the antibody can activate complement proteins, which can produce inflammation, chemotaxis, and lysis. In letter D, it initiates the release of inflammatory chemicals. An antibody binds to a mast cell or basophil. When an antigen binds to the antibody, it triggers the release of chemicals that cause inflammation. Lastly, facilitation of phagocytosis, wherein an antibody binds to an antigen and then to a macrophage, which phagocytizes the antibody and the antigen. So for the antibody production, of course, this is for primary response. This is first exposure of B cell to antigen, and B cell undergoes division and forms plasma cell and memory cells. So plasma cells produce antibodies around 3 to 14 days to be effective against antigen, and persons develop disease symptoms. And then we have the secondary response, wherein memory cells are found, which occurs when immune system is exposed to antigen that has been seen before, and B memory cells quickly divide to form plasma cells which produce antibodies. So in here also is the time wherein you produce new memory cells. So in this image, you will see how the antibody production happens. So antibody production in a primary response has a longer response time and produces lower numbers of antibodies compared to a secondary response. So by just checking on the graphs that you see below, you see here that there's a longer response in your primary responses compared to your secondary responses. So the cell-mediated immunity, it is effective against antigens in cells and tissues. This is also effective against bacteria, viruses, fungi, and protozoa. And it uses different types of T cells. So the types of T cells includes first your helper T cells, which activates your macrophages and helps form the B cells and promote the production of T cells. You also have your cytotoxic T cells. So this is a precursor of your cytotoxic T lymphocytes. Your cytotoxic T lymphocytes destroyed your antigen on contact. And lastly, you have your regulatory T cells, which turn off immune system response when antigen is gone. So in this one, it shows you the stimulation and effects of the T cells. So when activated, cytotoxic T cells form many additional cytotoxic T cells, as well as memory T cells. The cytotoxic T cells release cytokines that promote the destruction of the antigen or cause the lysis of target cells, such as virally infected cells, tumor cells, or transplanted cells. The memory T cells are responsible for the secondary responses. Next in this image is actually the immune interactions. It shows you the major interactions and responses of the innate and adaptive immunity to an antigen. So you have here what you call your antibody-mediated immunity, wherein your antibodies act against antigens in solution on or surfaces of extracellular microorganisms. And you also have here the cell-mediated immunity, wherein cytotoxic T cells act against antigens bound to your MHC molecules on the surface of the cells, and they are effective against intracellular microorganisms, tumors, and transplanted cells. So the types of adaptive immunity includes naturally acquired immunity. So you have the active. So this is natural exposure to antigens caused by the production of antibodies, and they can be lifelong immunity, like for example your mononucleosis. And then passive is a transfer of antibodies from mother to child, which is for example wherein babies get this immunity from getting breast milk or through the placenta. Next, you have the artificially acquired immunity, active. You have the injection of antigens using vaccines which cause the production of antibodies. Vaccine or immunization, process of introducing killed, live, or inactivated pathogens. And then you also have the passive type, which is the injection of antibodies from another person or an animal. So this is actually how we diagram both natural and artificial in active immunity and passive immunity to become an acquired adaptive immunity. So for the clinical correlations, so please check this information or the representative diseases and disorders on your book. So this is just a summary of the infections that are correlated when it comes to your lymphatic. So in this image, you will see here lymphadenitis for the first two images above. So this is because of the inflammation of the lymph nodes. And this is where the nodes become enlarged and tender as microorganisms are trapped and destroyed. So in Tagalog, we call it actually kulani. But if your immune response is weak, of course, yung mga kulani na ito ay lumalaki sila, namumula. Okay, but if your immune response is strong enough, of course, this inflammation of your lymph nodes would eventually low down and mawawala ito. Okay? So, more likely sa leeg or sa kilikili, basta kung saan meron kayong sugat o kaya infection, dun talaga lumalaki yung inyong mga lymph nodes. Okay? And then next, we have the lymphangitis. So this is the inflammation of the lymphatic vessels, often results in visible red streaks in the skin that extend from the site of infection. So another one is actually the bubonic plague. So this is because of the enlarged lymph nodes caused by the bacterial infection transferred by flea bites from rats. Without treatment, bacteria enter blood and death occurs rapidly due to septicemia, known as the Black Death in the Middle Ages. So as you see here in the picture, it would actually give you fever. It would also cause you to have headache and malaise. And of course, there would be swelling of your lymph nodes in your neck or your axillary. So there would also be pus exudation and bleeding. You may also develop gastric issues like your nausea and vomiting, and of course, joint pains and acne. So in here, you will see that the effect of the bubonic plague was actually, it looks like parang pinapatay yung inyong sistema and you tend to develop baga parang nabubulok, okay, yung part ng body na affected. So next is what we have here, your elephantiasis. So this is caused by long, slender, roundworms transferred to humans by mosquito bites. The adult worms lodge in your lymphatic vessels and block lymph flow so that a limb can become permanently swollen and enlarged, and the major cause of lymphedema worldwide. Okay, so this is because of infectious worms. So kaya dapat if you are fond of walking around without slippers or without shoes, okay? So, pagka nagkaroon kayo ng sugat, there would be a possibility that these worms would actually lodge in your, or would actually enter yung inyong sugat, and then magla-lodge sila doon without you knowing. And then, it would block your vessels and eventually would cause you lymphedema. So other diseases and disorders can be immediate allergic reactions such as hay fever. You also have your asthma. You also have urticaria. And then you also have anaphylaxis. So this actually happens, guys, when you eat shellfish or seafood and then hindi pwede sa inyo. So yung mga nafe-feel nyo na allergies are anaphylaxis, and even if you're also the type of person that hindi sila basta-basta pwedeng uminom ng ibang gamot like antibiotics or maybe mefenamic or mga pain relievers, okay? Kapag hindi pwede sa inyo ang isang gamot, usually nagkakaroon kayo ng allergic reaction like puffiness of the eyes, medyo nagiinit yung pakiramdam, okay? And usually kapag hindi naaagapan yung mga ganitong situations, it can be fatal, okay? And then you also have other delayed allergic reactions such as your poison ivy and poison oak. And of course, you also have your autoimmune diseases wherein, of course, it attacks your own immune system. Okay? Or kumbaga yung inyong immunity ay ina-attack yung sarili nyong immune system. So, it includes your type 1 diabetes, celiac diseases, rheumatoid arthritis, multiple sclerosis, systemic lupus erythematosus, and Graves' disease. You also have your severe combined immunodeficiency, which are congenital because of both B cells and T cells fail to form. And you also have your acquired immunodeficiency syndrome or AIDS, which is actually an example of a life-threatening disease caused by the human immunodeficiency virus. So these are um, examples of your urticaria or the hives, and then on the right side is the swelling of your conjunctiva or the lips because of the anaphylaxis. Okay. So this one is yeah, for AIDS and severe combined immunodeficiency, and then there can also be transplanted tissue rejection. So this also happens when, for example, somebody is having a surgery and the transplanted tissue is not being accepted by the body. Of course, there could be immune response that would happen. Okay? Hindi lahat kasi ng nilalagay ng katawan, at lalo na kapag hindi pagmamayari ng isang katawan, usually nire-reject talaga yon. Okay? So, these are the main symptoms of AIDS. So, first, you can develop encephalitis or meningitis or pamamaga ng inyong brain. And then, of course, retinitis. So, anything that has itis on the end of name, usually swollen or pamamaga. So for lungs, you can develop pneumocystis, pneumonia. You can also have tuberculosis of the multiple organs and tumors. Of course, you can also have skin patches like this. And then for your gastrointestinal tract, you can have esophagitis, chronic diarrhea, and of course, tumors. So this is how um, kagrabe yung tinatawag natin na AIDS. Okay?
That ends my lecture for lymphatic system. Please do subscribe to this channel, and if you have any questions, just drop your questions on the comment section down below, and also hit on the notification bell so you will be notified every time na meron tayong bagong lecture. I'll see you guys next time.